So I think the main purpose of this was to provide an availability of not only the county, but also some of our department directors that manage some of the departments that have a lot of the public coming and going throughout the day, every single day. And Eric, I'm going to let Eric Gilmore, our Director of Emergency Management, begin. But just to make sure that these folks that may not be familiar to you, I want to make sure that I introduce them. So Eric Gilmore is our emergency manager. I know you know the mayor. Hopefully you know Chief Craner. John Dosh is our interim public safety director currently, and he'll be able to provide questions or answers on EMS and fire. We have Tanya Ellis, who is our ECAT director for public transportation. We have Cassie Boatwright. Cassie Boatwright is our Director of Facilities, and what she manages are obviously all the 200 buildings that the county manages every single day. And then, you know, Chip Simmons, I appreciate him being here. We have Chief Powell, who is our Director of the jail. And then our last person, but not least, is Superintendent Malcolm Thomas. So you know who all's here. And then, like I said, I would like Eric to just begin with a little bit of an update on where we are in terms of Escambia County.
Thank you, Ms. Gilly. So right now, as the state goes, the state EOC, from emergency management background perspective, the state is at a level 2 activation, which is partially activated, and that's so the resources and funding and information can flow freely through the state EOC. Statewide, there is only one EOC activated at level 2 at this time, that's Hillsborough County, and they have one case in their community of confirmed COVID-19. The only counties in the state of Florida under a local state of emergency is Seminole County. They did that preemptively. They have no cases at this time or any transmission in our community. So what does that look like for us? Right now we are level 3 activated. We're always monitoring, putting out the health messages. You heard Dr. Lanza say earlier, we are under a prevent and contain type situation. So as we do these precautions, social distancing, use proper hand washing precautions, disinfecting public spaces, hopefully we can prevent, contain, and we do not have any cases in Escambia County. As it stands right now, we are at level 0 on COVID-19 cases. If we did start having transmission, then you would see the activation of the EOC to a level 2. We're talking, we would take direction under Department of Health. They are the lead agency, so in coordination with DOH, we make those decisions at that time. When we started having cases of transmission, and then of course we would have discussion with our local officials about local state of emergency. So as we stand right now, as I said, we're monitoring. No transmission occurring in Escambia County, and we're putting out the health messages and backing up with CDC guidance and DOH guidance. Yes. So.
Okay.
Thank you.
Cordes, if you want to start with the first question.
Yeah. Yesterday we saw that you're doing the declaning of some ECAT buses. Could you give us an overview on what throughout the county is going through any sort of deep cleaning or any changes surrounding COVID-19?
What we're doing right now is we're doing a deep disinfecting and sanitizing of all of our vehicles every night. We have increased the comprehensive level of that cleaning, which includes commercial grade, hospital grade disinfectant for all of our buses. We also have hand sanitizer, gloves and masks available for all the employees, as well as we'll be having some additional sanitizer available. We have dispensers throughout our facility as well. We have notifications throughout the building as well for not only the employees but also the public.
And to follow up that, in terms of supplies, you feel you have the adequate amount of cleaning supplies, masks, gloves, everything to do that job?
We have some additional supplies on back order, but right now at this point we do have enough at this current point.
We are doing the same exact thing that ECAT is doing for the county facilities, ramping up our services, ensuring that we have not only the evening, nighttime cleaning, but also day cleaning as well, where we have large volumes of people. So we're following the exact same technique as ECAT is following. Jim?
We've seen nationwide, like events being canceled, NBA games being suspended. Is there any discussion or anything here? We have, anywhere from like local parks where Little League games happen to the Bay Center. Any discussion about postponing events or anything like that?
Sure. So as I said before, we start seeing transmission, I think that's going to be a key indicator when we start interacting with our Department of Health partners. It's going to be a local decision from Dr. Lanza of what he's seeing pushed up through the state state health office, and it's going to be a decision made out of Tallahassee. So we will monitor here, and as we see those things, it's going to be, as I said, DOH is the lead agency on that. We are taking their direction, and if they decide that we start doing, stop having large social gatherings, then that's something that we're going to take direction from Department of Health and the State Surgeon General.
Okay, I think the mayor wants to.
Yes, sir.
Simply, I think the advice that also goes out, if you don't feel comfortable, if you feel that you have for reasons of age, a variety of other issues, that you have an immune system deficiency, then I would understand you making that decision and self-selecting. That's really on you. Everybody's got to be aware of what their own conditions are and what they feel comfortable with. And I would not encourage anybody that did not feel comfortable doing something to do something. So I think, that was the one thing that I learned from being with HHS the other days. It really is going to be dependent a lot upon individuals and their immune systems. And really, they've been interesting advice. While it is a novel disease, what they told me is it still fits within the coronavirus systems and what they know. And eventually, a lot of the things that they recommend they sound like somewhat wives' tales, but they're actually there. I mean, eat well, get plenty of sleep, exercise where you can. Obviously, not saying necessarily go to somewhere else where you're in contact, but there are opportunities for you to do a lot of just living well and eating well kind of things. That boosts making sure that you're having a diversity enough that you have your vitamins and minerals. This is when I talked to HSS, I asked them, I said, what can I tell people? That's what I want to know. They said, that is what we would tell you to fight the flu. And this is, while it is a novel COVID, it is still a coronavirus. And at this point, it will still fit in those ways. And if you can do anything to bolster your immune system, those are the kind of things you need to do. They stress sleep to me so much on that issue. Everybody's got to be taking care of themselves.
Okay, Eric, I'd like to ask a question.
Yes, sir.
How do we know that the virus isn't being transmitted in our county now?
That's determined by the Department of Health. They're doing the swabs or the contacts with the people. So DOH has got the handle on that.
Do we know how many swabs have been done?
No, sir, I have no
So the
idea.
county hasn't told us that.
No, sir.
So how can we say that we don't have transmission?
Taking the advice of the Department of Health.
So we depend on the
Department of Health
who's
to-
not here to share the information.
Yes, sir. Something, go ahead.
Yeah, first and foremost, if you start seeing signs and symptoms, they're going to certainly, you go to the doctor or you contact the doctor, they're going to do the swabs. And at that point,
So there's no problem with anyone getting a swab who wants to have a swab?
if you're showing signs and symptoms, they're just not going to go out and no swab or swab 300,000 residents because there's a potential. If you've got signs or symptoms and you go through that process and they determine that you warrant having a swab and that's sent off to be tested, they'll certainly do that.
And I think you can also speak about what you're doing with EMS
Right.
as far as the race.
Sure.
I'll let you finish, I got
Yeah.
a follow-up.
Okay. And certainly we're doing a lot of, through the 911 system, we're asking people additional information about, their activities, where they've been and all that stuff. We're doing that through the 911 system and certainly working through our responders to make sure that they're aware of any high-risk activities that may have occurred so they can take the appropriate action to protect themselves.
So for the public, if someone feels that they have symptoms, there's no barrier for them to be able to get tested?
I am not a doctor. I would have to leave that up to the health department.
of Health.
That's correct. They run the health system in our state.
Right.
So, but if you are sick, the direction that Dr. Lanza provided us earlier is to make contact with either your health provider or the health department, provide them the information about what's going on with you, where you've been, and they will direct you appropriately. And if you meet that criteria, they'll do the appropriate swabs and the appropriate testing.
And I know, the issue that I see though, and I've talked to the hospitals, is that, it doesn't seem to be that simple. And maybe it is that simple now, that people cannot just easily just get tested. But your impression now is that if anyone feels they have symptoms, they can get tested.
That's the understanding that I have, and basically what I heard from Dr. Lanza. You know, he gave that direction earlier in the presentation, so I can only take him at what he provided. Okay.
Superintendent Thomas, we've heard from the university, the college. What are the plans for the school district right now for classes?
Well, we're certainly going to continue with classes at this point in time. My situation's a little different than universities. If you're talking about UWF or Florida State, you're dealing with older students that have the means and the resources to shift easily to online. I'm running a system that starts with pre-K children, age 3 through grade 12. Many of our students, because of poverty, if you don't have classes, they don't have lunch and breakfast. So I'm looking at all those issues. Our hope is that you contain it. We do know from the guidance we've gotten from the Department of Health that this is very low risk for students. My concerns are really about the grown-ups or students that would go home to grandparents, those kinds of issues. But there's no information I have that says. So we're going to continue to try to finish the year. My biggest concern at this point, to be honest with you, is next week is spring break. And I am trying to communicate information to parents as well as staff. I know a lot of people are going to travel. We're communicating that we're going to adhere to the CDC guidelines, which, as you know, change every day. So if you travel to a place where they expect you to be self-isolated or quarantined, we're going to expect that to happen for the student if that's required by the Department of Health or a physician, as well as parents or staff that might travel. So we're trying to let them know that ahead of time before they actually implement any travel plans that they have for next week for spring break.
Have school nurses been giving any briefings on what to look for?
They coordinate every day with the Department of Health. We have nurses or nurse techs in every school. And by the way, this isn't about your press conference. I really want to clarify my quote from Dr. Lanza. that quote happened about 6 years ago. Mr. Burgage, you will remember we had an incident where the funding was cut for the Department of Health. And so it was going to be incumbent upon the school district to bring in the nurses and find a way to pay for them. And my quote to Dr. Lanza is, we won't worry about your funding. We'll do the best we can. And the best for us was to make sure every school had a nurse that covered the school and had health techs that helped. So yeah, they're very much in tune with the process. We've been pushing out the information, all the things about coughing your elbow, frequent hand washing, educating students and staff. We've stepped that up. We've always done it, but just step it up a little bit more now that we're in this environment.
Is there a line that could be crossed with number of cases or something where you might reconsider?
Well, there always is. I mean, we have a plan. We typically think of things like measles and whooping cough. The way that works, headlights. We look at how many incidents are in a single classroom. If you pass a threshold, then we would excuse the class, let that class stay out. If it gets to a higher percentage of the school that gets to a threshold, again, we're working with Dr. Lanza and his team, then we'd shut down a school. We've never had an incident in the past 12 years when I've been superintendent that we've had a contagious disease where we've had to implement anything beyond a classroom, but we do have plans where you could do that. If we had to close the entire school district, a day or two would not be a problem. If it went on for weeks and months, that could be problematic. The good thing for me, after spring break, we're down to like 6 weeks and school will be out. So if we can just keep containment a few more weeks, allow us to get through the school year, hopefully this can run its course and we'll be able to start next year in a normal fashion.
Thanks.
Before asking my actual question, to follow up to what he was asking you, in the event of any large-scale self-quarantining or anything like that, what's kind of the plan as far as students staying home and failing work or anything like that? Are you encouraging teachers to understand the situation? What are you doing?
Well, what we will do, I mean, it depends on the volume. If we got to the place where I had to shut down a school, for example, we're fortunate in that all of our students, grades 3 through 12, have Chromebooks. Students K through 8 are already logging in every day when they're in school to an online personalized software product. So their lessons are already there. They could do that from home as well as they could from school. Now, trying to follow up with a kindergarten student, everybody knows that you don't just give the kindergarten student a computer, an iPad and just say, go. Somebody's going to have to guide that. So we would have to gear up a cadre of teachers that would work the phone, be able to communicate with family and students. We're participating with the Department of Education. They're trying to create a cadre of teachers, about 10,000 strong in the state of Florida, people that do not currently teach online courses, that at a moment's notice could be activated and could work that phone bank and could have students activated in Florida Virtual School or make use of other assets that a school district would have. So we have plans, they're not perfect. We could realize some of our students don't have access at home. So it's real easy to say, we'll just go online. But when you have probably 15 to 20% of your student population without internet access at home that's adequate enough to run some of our products, that is a problem. So we would have to convert to more telephonic instruction for some of those students. We'll cross that bridge. We're trying to discuss now, what can you do? How can we better plan if we get to that point? We're hoping we don't.
And what I wanted to ask was, in the jails, in the corrections side of the thing, what's being done there? Are there any limitations to people visiting a loved one that may be an inmate or anything like that?
No, our visitation is done remote already, so that's not limiting family from visiting the inmate population. We deal with a health concern on a continuous basis. This virus doesn't change anything particularly that we're doing, knowing that it's in close proximity, people are in close proximity. We are in a continuous state of cleaning in the jail. We have developed a few additional things just to be precautious right now to elevate it a little bit. But we deal with tuberculosis, hepatitis, all the communicable diseases right now as we stand. So this is just another list in the list that we manage.
What are those things that you mentioned?
As far as?
You said you're doing a couple additional.
I'm just putting a little bit more frequent cleaning than what we did. Rather than once or twice a day, we do it 2 or 3 times a day. I've introduced a pandemic plan that didn't exist before that addressed staffing concerns should we go into a heavier situation. That's all in play.
And I think you're pre-screening as folks
Yeah.
are coming in.
And as Ms. Gilly just said, one of the first people that anybody coming into the intake process meets is the medical personnel. They are going through asking the appropriate questions right now, followed on by signs, symptoms, et cetera. And that's all assessed as they go through.
Thanks.
Yes, sir.
Jim, we'll just do one more question.
What's the situation like at the city airport right now? Are y'all screening anyone coming in for flights?
At this one, I don't know of anything that we're necessarily screening at anything, but I think what we said here earlier today is there are plans. There are already operation plans. We've been talking with Chief Craner, and I have the utmost confidence in the county with John Dosh and been involved with emergency operations here. There's a plan at which time certain things happen, we will move forward. I haven't had a chance to talk directly with Dan since coming back about where we are with the airport, but I imagine we are moving forward with those plans. Jenny has been keeping us, Chief Craner has been keeping us up to date on everything that we need to be doing at the city. She has been in full contact with the county. They're the lead agency in emergency. Everyone here said, expect things to change as stuff moves along. This is no different than what we have with hurricanes. As the hurricane gets closer, we end up doing different things than we do when it's far away. Right now, while again it's on the doorstep in a sense, certainly operations could change as other things may happen. So again, what we're telling you is where we are today, but this could be very fluid and we could be changing going forward. It is certainly a place that we look at. The airport is clearly an issue. And listen, having had to fly yesterday, it's not fun to be in an airplane. You do want to get out of there as fast as possible, but at the same time, we are working through all that. We continue to be looking at everything we can do. We have a plan. We're going to follow that plan. We're going to execute the plan. If the plan needs changing, we will change that plan. So again,
I will say Dan has said that they're increasing the frequency at which they clean touch points at the airport.
if you're hearing touch points at the airport are being, frequency cleaning is changing on that. So again, we are doing that, and the airport is moving forward with those kind of things. So I think the key is to realize this is where we are today. If we see something different, we will change. The plans will fluctuate as the levels change, and I have all the confidence in the world
in the Escambia County Emergency Operations, and I know that Chief Craner is very involved and embedded with them, and I feel confident what we can do.
For Janice. What is the communication plan coming forward?
Yeah, I think that's an excellent question, and I appreciate you asking it, and I know why you're asking it. I think that while this is not completely like a hurricane or maybe even BP or some other things where we've activated the EOC, I think that's why we've had a void. And I do, like I said, took a point of personal privilege earlier to apologize to you all for that. I think that Laura and I have talked about it. They have been communicating as PIOs with each other. Casey, I mentioned Casey and Nicole and some others. So what we would like to do is create a communications plan for you all, whether it's a document that we provide, and that if those that want to participate can voluntarily participate with us, whether it's the PIO at the sheriff's office or at the school district, the city, all of the different ones that could come together, maybe if the hospitals would like to participate, much like we would do if we did have the Emergency Operations Center activated. As you know, when you have that activation, we have that consolidated, coordinated effort, and so you know throughout the day that you're going to get that information. So I think absent that activation, I think that we can provide that through all of the folks that do manage communications each and every day. And so the only thing I would say too is that I think that the other questions that you've asked about test kits and things like that, a pandemic is a little different than some of the other issues that we've dealt with, whether it be infrastructure issues with a hurricane or a BP oil spill, things like that. There may be people walking around in our community that we don't know yet have already contracted the virus. That's what makes it a little different. When we have those other things, we do typically see damage to infrastructure, tangible things that we know how to prepare for, respond, and then recovery afterwards. So I do think this is something that's going to change on an hour-by-hour basis. I think the president mentioned that last night. And so, we do have to try and find ways to make sure that we are getting the information out to you and that we are managing it. And I think the last thing I would say is that if you're a praying person, I think you should pray for our community. I think you should pray for any community, or particularly the state of Florida and the country, so that we don't necessarily have an expansion of this disease to the extent that we have issues that shut down all of the operations and things like that. So I think is that, do you want to?
No.
He
I was
wanted
just
to
going
say
to
something.
say, I was going to say something about that Monday. I think one of the problems here is people, Janice, they feel like they're like, what can I do? I feel like a lot of people want to know what they can do, and we're fighting something that's totally invisible. So I do think there's a lot of that point, which is why I wanted to communicate again what was talked about, what you can do, small little things that you can do in your everyday life, just making sure that you're eating well, sleeping well. And I agree, if you feel so inclined and you feel like you want to do something, I do think prayer is certainly one of those things to go to your house of worship and do. I think that's something that you feel like you have control over. I think that's the hardest part about dealing with something that's an invisible situation that we can't see, we don't know what's happening, and it is very difficult psychologically from. That's why when I was with HSS, I want to focus on what can I tell people they can do, because so many of us, we want to know that we can do something, and I think you heard Robert try to say, sometimes we don't want to create a panic where people start doing things that are counterproductive. We want to be channeling people's behavior into things that are productive both related to the virus and just working together as a community. I think that's what you're going to see at Escambia County, City of Pensacola, all of us working together to try to do.
What quick follow-up on that, but what will be the trigger for activating the EOC?
We've discussed this many times, but
Yeah.
if you want to.
So, once we see active transmission in the community,
After the Department of Health?
after the Department of Health has notified us, because they are the lead agency, when we start seeing those numbers increase, the EOC will be activated so that we can all be on the same page as the EOC does during times of disaster. So, thanks.
Thank you.